Well, good morning, good afternoon, or indeed good evening, depending on where you are joining us from on this World Obesity Day. It is quite an exciting day for many of us patients and advocates across the globe as we unite on a very, exciting day. We have awareness campaigns, we have beautiful imagery, as you can see behind me, and we have a lot of narrative and messages. And speaking of that, you want to know what's going to happen in the next hour? Well, coming up for you, we have the launch of patient videos, which is really exciting for us as we work with 5 different patients to hear the quality of their life after they've received treatment for their obesity. We will be going live to our reporters in each country, from Germany and Ireland, from Switzerland to Portugal and Spain, in Netherlands, UK, Slovakia, and we will end with our wonderful team over in Sweden. Now, if you want to support us online, please use the hashtags. Make sure you're getting in Obesity Day Europe. If you can also use hashtag World Obesity Day, and if you want to watch this back, you will be able to because we are recording it. Now, as always, a huge thank you to our sponsors, Novo Nordisk, our supporters, Yazo, and Medtronic, who have made these videos possible for us. So let's get to it. Let's not waste time listening to me, but let's jump to Marion in Germany and see how she got on after she had received treatment for her obesity.
Ganz viele denken einfach, wir sind nur faul. Wir wollen nichts tun, wir sitzen auf der Couch und wir sind immer fröhlich. Dicke Leute sind komischerweise immer fröhlich, sitzen auf der Couch, stehen aber nicht gerne auf und essen den ganzen Tag. Fernseher schauen, das machen dicke Leute auch noch gerne, aber ansonsten nichts. Aber sie haben einfach nicht, sie schaffen es nicht abzunehmen und sie möchten das auch gar nicht, weil sie fühlen sich ja anscheinend so wohl. Und das muss endlich aus den Köpfen raus. Es muss raus, dass diese Stigmatisierung endlich aufhört und dass wir wahrgenommen werden als Menschen, die krank sind. Wenn mir das jetzt niemand mehr ansieht, vom Gewicht her, man sieht es mir einfach nicht an, aber die Krankheit Adipositas, die bleibt bis an mein Lebensende. Das Thema Essen war natürlich immer ein Riesenthema bei uns, Essen. Von meiner Mutter die Seite, die Familie, immer die Frauen waren immer dick. Also war auch das bei uns immer ein Thema, als ich klein war. Hoffentlich wird Mario nicht dick, hoffentlich wird Mario nicht dick. Dann wurde auch mal Essen weggeschlossen, weil sie Angst hatten, dass ich was esse. Süßigkeiten wurden nie gekauft. Schon sofort, wie es angefangen hat, schon in der Schulzeit, also schon mit 7 Jahren, als es anfing, wusste ich bin anders wie die anderen. Dann habe ich alles an Diäten probiert, was es gibt. Ob es Brigitte-Diät war oder nur noch Eintöpfe gegessen oder den Kohltopf oder Pillen genommen. Ich habe mich spritzen lassen, ich habe mich hypnotisieren lassen, ich habe Therapien gemacht, was möglich war. Aber alles selbst bezahlt. Niemals hat eine Krankenkasse da mitgeholfen, niemals hat ein Arzt mitgeholfen. Also alles nur Sachen, die ich selbst gefunden habe. Ich habe bei jeder Diät abgenommen. Aber der Jojo-Effekt und das Zunehmen war extrem. Ich bin ein Mensch, der gerne einkaufen geht. Ich gehe gerne bummeln. Ich habe es am Schluss noch nicht mal mehr vom Parkhaus in ein Modegeschäft geschafft, weil mir nur noch die Rücken wehgetan haben, die Knie haben mir wehgetan. Man wurde immer noch mehr von Leuten angeguckt. Also es war dann ganz schlimm, wie ich gelaufen bin und ach guck mal, da kommt sie und wirklich böse Sache, negative Sache. Und es tut immens weh, wenn man draußen ist. Und dann eben 2007 war das, wo ich gesagt habe, stopp, es geht nicht mehr. Es geht einfach nicht mehr. Und dann war wieder ein Bericht auf dem Fernseher, diesmal aber um eine größere Operation, eben Magen-Bypass oder Sleeve. Und dann habe ich gesagt, das ist meine Rettung. Ich bin operiert worden und am nächsten Tag war ein neues Leben da. Es war endlich ein Leben, ohne ständig Hunger zu haben, ohne im Hungermodus zu sein. Ich war mein ganzes Leben durch die vielen Diäten ständig im Hungermodus. Wenn schlanke Menschen sagen, die können das nur nicht mit dem Abnehmen. Ich glaube, kein schlanker Mensch hungert sein Leben lang so viel wie ein adipöser Mensch. Diese Operation ist kein Freibrief, dass ich irgendwann Massen essen kann. Die Operation ist einfach so, dass sie den Stoffwechsel verändert und ich weniger Lust auf Süßes habe, weniger Lust auf Fettiges, viel weniger Hunger. Also der Hunger ganz wenig, so gut wie gar nicht, aber das Sättigungsgefühl da ist. Ich konnte freier sein, ich konnte rausgehen, ich konnte mich bewegen und es ist so schön, am Leben teilzunehmen und dieses Gefühl, schlank zu sein oder schlanker zu werden, hatte ich ja. Ich wusste von früher nicht mehr, wie sich schlank sein anfühlt. Adipositas ist eine chronische Krankheit. Bleibt nicht alleine, werdet aktiv, holt euch Hilfe, geht raus, schaut im Internet. Es gibt 3 große Patientenverbände in Deutschland. Schaut auf die Seiten, dort werdet ihr die Selbsthilfegruppen finden und besucht sie einfach. Geht raus, werdet aktiv.
And a huge thank you and round of applause to Marion in Germany for a tremendous video. And I know so many people will actually be able to relate to what she's experienced, what she's been through. However, we're talking about Germany. Let's hop over to Andreas. Andreas, the floor is yours for the next 3 minutes. What is going on today? I've seen your campaigns. They're so exciting, my friend.
Thank you, Vicki. Well, based on the idea or the motto of this year's campaign, like addressing obesity together and everybody needs to act, we planned a campaign that aimed to move away from talking and get people into action. And as we still have COVID in Germany, we did not plan for in-person events. So this is an online campaign, online only. So we tried to produce some stuff for Facebook, Twitter, LinkedIn, etc. And each of the motives should include a call to action. It should involve the viewers. And so we decided to have a picture of a person in it, a member of our community, and together with that, a clear call to action for some of the groups that can do something. And as World Obesity Day is always a really busy day, we already started 2 weeks ago, showing one topic a day until now. So examples of that are like this one. We started off announcing that World Obesity Day will be in 2 weeks' time. And this is one of the other examples. This is Errol, one of our members, asked the people to get loud, to actually talk to others about their problem and their issues and what they need, and not only sit on the couch and just think about it. This is another example. People should not only wait for the patient organizations to do something. We give them material, we provide like guidelines to them, and then they can write letters to their legislators. And this is one of our favorite motives. I assume you will see Marion again and remember her. That's myself in the middle and wonderful Melanie. Everybody can be a hero by just doing something for one person, doing something for a group, or try to reach a legislator. No matter on which level you work, you can be a hero in your daily life. And basically, everybody needs to act and everybody can act. And the examples of that campaign that we've shown so far and some others, they can be found on that website that we created for this event. And just to summarize it, the whole thing is a great success. We are really happy in how it's run. We have 50% more reach than in the last campaign, double times the interactions. And it's really great to see that people not only share and like that stuff, they as well create their own things. So like one lady that had told her story in our magazine. Today she posted that story and linked it to our campaign and to the World Obesity Day. And that's actually good to see that everybody do something. So thank you so far.
Thank you so much, Andreas. I have to say, the superhero picture is such a fantastic one. And people say, hey, are you promoting obesity? No, we're promoting awareness, and we are right behind you in that. So thank you so much for your work in Germany. We're going to jump along now, and we're going to actually speak to our colleagues from Ireland shortly, and Tina will join us. However, we do have a short video because in Ireland, there is a lot of co-creation, a lot of conversations between the healthcare professionals, the patient community, the scientists, the researchers, and let's have a peek at how some of those conversations and those videos have been going around social media today.
When I was 22, we decided to start trying for a family, and I was told because of my obesity and polycystic ovarian syndrome that I would have trouble conceiving. We tried for like 5 years, and being told that as a 22-year-old woman, it just brought me into years of depression and just not caring about myself, self-stigmatising and bullying myself. But then I went on to have pregnancies, 3 pregnancies, and I now have 2 little boys. But I was just wondering if you would have much experience with that.
Thanks for sharing that, Leanne. There are definitely lots of connections between fertility and obesity that I think aren't very well understood, and certainly not by the general public. We know there's definitely a link with PCOS, and it's one of those things that I suppose maybe isn't spoken about as openly, particularly if people have had difficulty conceiving or miscarriages, and there can be a lot of stigma around it as well. And perhaps when people talk to healthcare professionals about those areas of health, their concerns often aren't addressed as well as they could be.
How tremendous is that sneak peek of the conversation between Catty and Leanne, and these educational videos have been flying out of the ECPO media, social media, all day, so please make sure you go and you support them and share them. Now, I want to jump over to Miss Tina Gates, a friend and colleague of mine and a board member for ECPO. Tina, can you give us a few moments of your time and tell us what's happening in Ireland today for World Obesity Day?
Yes, our campaign this year is a collaboration between the Association for the Study of Obesity Ireland and ourselves, the Irish Coalition for People Living with Obesity, the ECPO. We decided to create some video recordings between healthcare providers and people living with obesity to raise topics that are usually discussed, but also those not often discussed, like Leanne did just there. Well, in fact, we ended up recording so much footage that we only took snapshots of those stories to share with everybody today. And after World Obesity Day, we're going to use all of that rich content that we've found to create educational videos that we can continue to use and continue to raise awareness with long after World Obesity Day is over. For the recordings themselves, we've seen over 50 people take part, which is really brilliant. Healthcare providers, people living with obesity, and really exciting, healthcare students. And that's so important to us because we're really trying hard to share information with a whole new generation of healthcare professionals. We want to continue our work in having stigma education put onto the curriculum for healthcare students, and seeing students join our ACT video is a really positive sign. We've had over 5 print media articles in the past week alone and over 10 radio interviews, and all very engaging about the challenges that people living with obesity face. Now, that's a huge increase in interest compared to last year, and it's largely very positive. Also, we got to see images from our own image bank rolling out through print media, which was very exciting this year. Beautiful, positive images of people living with obesity. You see, we really believe that these campaigns are crucial in continuing this change, and we are making a difference. So we want everyone to join in on social media and help us to spread the science, not the stigma. The hashtags are hashtag WOD Ireland and hashtag Obesity Day Europe.
Thank you so much, Tina. And it is tremendous to watch the work online. I have seen so many active advocates. I've seen fantastic pieces from the Irish Examiner. I've seen Maura, Susie, and all of your team. Bernadette, Catherine, if I forget anybody, I apologise, but congratulations to you all on advocating so well and so brilliantly. Now, I actually want to jump across to another video that we did with a wonderful man and his dog. Do not let the dog steal the show on you. Ralph, I had the pleasure of meeting, and he's a tremendous gentleman from Switzerland who has gone through that treatment process also. And Ralph is going to share in his next video just what he experienced and what he felt was important.
Ich war ja bis 64, 63 so, war ich übergewichtig. Klick gemacht hat es, glaube ich, erst, als ich mir die Frage gestellt habe, was machst du in deiner dritten Lebensphase? Was machst du in der Pension? Willst du dann zu Hause sitzen oder mit dem Rollator oder mit dem Rollstuhl leben? Da habe ich gesagt, nein, das kann nicht sein. Das ist nicht meine Philosophie, nicht meine Lebenseinstellung. Du musst etwas tun. Ich habe diese Operation 20 Mal oder 30 Mal im YouTube angesehen, um zu sehen, was passiert jetzt mit mir. Und ich hatte volles Vertrauen in dieses Operationsteam. Die Operation war problemlos. Ich bin nach 4 Tagen wieder nach Hause gegangen. Und dann hat das begonnen, man hat gesagt, ja, wenn du diese Operation machst, dann hast du das und dann musst du da aufpassen und da aufpassen, du kannst das nicht essen und jenes nicht essen und dies nicht essen. Und meine Frau hat sehr intensiv mitgelebt mit meiner Aktion im Krankenhaus und sie hat gewusst, was auf uns zukommt. Und ich habe dann nach der Operation 40 Kilogramm abgenommen. Die Angst, die ich hatte, meine Hüftgelenke kaputt zu machen, meine Kniegelenke kaputt zu machen, meine Sprunggelenke an den Füßen kaputt zu machen, Diabetes zu bekommen, Hypertonie, Bluthochdruck zu bekommen, das ist alles weg. Und es ist wie eine neue Welt aufgegangen. Ich wurde vom Spital eigentlich sehr positiv begleitet. Ich brauchte keine psychologische Begleitung eigentlich, aber die Unterstützung war professionell. Für mich, ich sage jetzt mal für mich genügend. Oder auch der Follow-up, der medizinische Follow-up, der war absolut perfekt. Die Operation ist quasi ein Hard Fact. Und es gibt ein ganz klarer Schnitt im Leben mit der Operation. Und mit dieser Operation einerseits physikalische Veränderung, ändert sich auch der Mindset. Das hat bei mir selbstverständlich auch ganz massiv gewirkt. Ich happy da eingestiegen, da gibt es noch einen Nebeneffekt. Mit der Operation hat man mich gebeten, repetitiv beim Arzt vorbeizugehen. Und so bin ich jetzt eigentlich jedes halbe Jahr im Radar von meinem Arzt und ich komme immer mit einem guten Resultat nach Hause. Das ist psychologisch wahnsinnig motivierend. Ich glaube, ich habe mit der Entscheidung, dass ich diese Operation gemacht habe, einen ganz wesentlichen Beitrag dazu geleistet, dass es mir persönlich, aber auch uns in der Familie gut geht. Heute habe ich genügend Energie, auch mit den Enkeln, mit den Kindern, mit den Enkeln etwas zu unternehmen, zu spielen, zu weiß ich was alles. Weil ich genau das gemacht habe, was die Begleitung im Spital von mir verlangt hat, dass das Resultat am Schluss auch sehr positiv war. Positiv im Sinne der Operation, positiv aber auch für mich im Sinne meiner Psyche. Es geht mir fantastisch. Es geht mir wirklich hervorragend.
And a huge thank you to Ralph in Switzerland for that really good video. I listened to that and I've watched it, and I tried to understand the German, thank heavens for the subtitles, but the importance of the multidisciplinary team, the importance of having, you know, that good psychological mindset when you're going into surgery is so important to get that message out. So huge thank you to Ralph. Now, I want to jump across while we're on the focus of Switzerland to Dr. Dominique Jur, who is a patient representative, a GP, an all-round wonderful lady. Dominique, can you share with us for a few moments what has been taking place in Switzerland today?
Yeah, thank you, Vicki. So in Switzerland, Eurobesitas was invited for interviews on radio and TV yesterday and today. And the main topics were the recognition of obesity as a disease, of course, on one hand, and the internalized stigma on the other hand. And the video on internalized stigma that we have done was very much discussed, and the journalists were touched by the suffering of the people living with obesity, and they didn't know the reality of internalized stigma. So they were also very impressed by all the information work done by all the ECPO team. I will discuss also on that. And we are very happy with our action against stigma. Our video on internalized stigma has been posted on the website of the Swiss Federal Office of Health and the website of the Swiss Alliance Obesity. And in addition, all universities in Switzerland will use it for training purposes for health professionals and doctors, as well for medical students, psychologists, and more widely for further conferences and education. So we can also announce that we will have versions with subtitles in Spanish, Portuguese, and Italian soon. We have also joint action with the GP Society to fight against stigmatization, but also for prescription of adapted activity. So GPs can call on specialists in adapted activity who will visit patients to organize an adapted physical activity with them. So this is very useful. In addition, yesterday we were able to give a conference at the University Hospital of Lausanne on obesity as a disease in the presence of hospital doctors and GPs. And thanks to the Swiss Obesity Alliance, which brings together patient associations such as the Eurobesitas and SAPS, and the professional associations of doctors, researchers, and surgeons. We have made contacts with several politicians, and we will have the opportunity this year to have meeting with the parliament to plead out the case, and obesity is a disease. And I would like last to thank particularly our Eurobesitas committee members who did really so much work this last day and of course today.
Thank you, Dominique, and it is really tremendous to see the work that you and your team in Switzerland, but also your stigma committee in ECPO have done together, and you have led that quite powerfully, and there is so much information out there. So please, if you are looking for information, infographics, materials, please go to the website and you'll be able to find out more. Dominique, I wish you well for the rest of the day. Now, if you are watching online, please share our social medias. If you hashtag ECPO Patient Lounge, that would be great. However, you can also hashtag Obesity Day Europe and hashtag World Obesity Day. You will see actually that it's a flood of social media. It's hard to express just how much content, how much passion is behind the drive for disease recognition, to stop obesity stigma, and so much more. So please, please, please share. Now, we are going to move over to an absolutely beautiful video that I love. It was filmed in Seville, one of my favorite places in Spain. And Marcos Antonio is a true gentleman. I had a pleasure of meeting him also last weekend. And let's have a look at his quality of life video after bariatric surgery.
llamo Marcos Antonio, tengo 51 años, actualmente soy agente de medio ambiente en el Espacio Natural de Doñana. Todavía estoy en 8 meses desde que me intervinieron, luego el procedimiento todavía está activo. En principio yo siempre he tenido desde mi infancia, he tenido siempre problemas de sobrepeso. Siempre he sido un niño que he tenido sobrepeso y pues con el paso de los años pues se ha acentuado y hasta que he llegado a una situación que ya era insostenible. El problema de la obesidad, en mi caso o desde mi punto de vista, mayormente te limita en el día a día. No es algo que te impida hacer algo en concreto, es en el día a día, en la movilidad continua, son en actuaciones cotidianas, sencillas, como amarrar el zapato, como caminar por la calle, como subir unas escaleras. Son situaciones en las que te encuentras incómodo, otras veces te cuesta muchísimo esfuerzo. Te vas enfrentando día a día a retos que para cualquier otra persona que no tiene este problema no lo son. Y para una persona con sobrepeso pues se le hace muy cuesta arriba. Yo tenía hipertensión arterial. Ya estaba tomando medicamentos para controlar la hipertensión arterial, y la cual desde que me sometí a la cirugía he tenido que dejar los medicamentos porque ya mi tensión arterial ha entrado dentro de límites de normalidad. Lo más difícil ha sido el punto de vista psicológico. A lo largo de este proceso que se prolonga por encima del año, es importante psicológicamente estar bien. Emocionalmente antes, pues había momentos de bajón. Cuando tenías dificultades, pues te veías con la hipertensión arterial, te sentías mal, te sentías incómodo. No es una operación para convertirnos en supermanes, es una operación para ganar en calidad de vida y en salud. Y en el día a día nos vamos a encontrar con una situación muy diferente a la que veníamos arrastrando. De poder empezar una jornada de trabajo por la mañana y poder continuar una actividad hasta por la noche. No llegar a mediodía completamente agotado del esfuerzo que te supone mover tu propio cuerpo. No tener dificultades respiratorias, no tener dificultades de tensión. Evidentemente, limitaciones que existían han desaparecido y me permite pues, conseguir hacer cosas que había renunciado a ellas. Ser realista contigo mismo, ponerte en manos de buenos profesionales, una carrera de fondo, de que existe una parte que es la que te corresponde a ti poner en lo alto de la mesa. Entonces merece la pena renunciar a ciertos hábitos que te perjudican para poder tener una vida mucho más cómoda, más relajada, más sana. Y en un futuro pues lo que espero es que esta situación que he conseguido pues que no se pierda. A todas aquellas personas que están en una situación como la que yo he vivido, animarlas a hablar con profesionales, no a tomar la decisión desde el primer día, sino a informarse, a ver que existe una solución para su problema y de que es posible cambiar la forma de vida.
And a huge thank you to Marcos Antonio for that very beautiful video and quite an inspiring video as well. One line that just sticks out to me is where he says, put yourself in the hands of the professionals. And something that we know about obesity is it cannot be just treated by yourself trying to manage it. you need support, you need a multidisciplinary team behind you. It is a lifelong chronic and relapsing disease. So speaking of professionals, one of my colleagues and dear friends, Mario, is joining us from Portugal. Mario, you are an advocate, you are a superhero, and you are in Portugal right now for World Obesity Day. What is taking place?
Hi everyone. So for today, for World Obesity Day, with the support of EASO, ECPO, and Novo Nordisk as a sponsor, we are launching today an app for families. So it is like Pokemon Go style. So it is an app that puts everyone on the streets looking for treasure hunts to collect digital cards that are content of health literacy for families. But the good things to share is that to find these cards to collect it through the app, the families need to find posters, outdoors, movies that are spread everywhere on the country. So it's more than it's 48 cities right now, but the emails are coming. So in the next weeks, more cities will join this initiative. So we have the logo of ECPO, of EASO, and World Obesity Day on all of these posters, all of these movies outdoors that are everywhere in the cities. And they interact, families interact through the app with this. So it is like a patty paper or a treasure hunt, but in a digital way. And it is an awareness campaign. So the objective is to put obesity on the map, on for all audiences to get the conscience that it is a disease, and it is everybody needs to be involved and to spread the message so that people who are living with obesity of all ages, including children, need to seek for treatment, for help, and go and have early diagnosis for getting help. So this is what is happening, and we are getting very media coverage about this that you can also see in our social media. We are sharing and using the hashtag, of course.
Thank you, Mario. It is really exciting. And speaking of, people in Portugal, we have the beautiful visual here of Alex, who took part in our image bank over in Portugal with his beautiful family. And a huge thank you from us to Alex for that. But I love the app. I love the idea of it. I love how it's so inventive. It's so different. And it's a great way to spread awareness of obesity. And children need to get online, download it. So we will be sharing it everywhere for you. So my friends, thank you so much for the update. And we will move on now. So we have actually, speaking of families, we have two beautiful ladies from the Netherlands who are sisters who underwent bariatric surgery themselves, going back to 2020, on the very same day. Now, their video explains a little bit of what their life is like now. So let's have a look at what Sandra and Colin had to share with us.
Ik had wel gewoon lichamelijke klachten. Hè. Die hoge bloeddruk wilde ik gewoon geen medicijnen meer voor slikken. En daardoor kreeg ik ook last van heel het lichaam. Pijn in de knieën met lopen. Hè. Dus dat was eigenlijk bij mij de hoofdzaak.
Vooral als ik dingen moest gaan ondernemen, waren het eigenlijk altijd wel dingen waar ik van tevoren me eigenlijk heel druk over kon maken. Van, goh, kunnen bepaalde dingen wel? En daar ging ik dan zelf eigenlijk al op voorbereidend te werk, zeg maar. Van, goh, als ik iets wil doen, dan moet ik daar zelf voor zorgen dat het dan ook zou kunnen. Om daar bijvoorbeeld hulpmiddelen of andere dingen voor bij te gaan bestellen bijvoorbeeld. Steeds vaker zeg maar, was dat wel een belemmering voor mij om dingen te doen. Of om te kunnen genieten van dingen waar je eigenlijk normaal gesproken niet over na zou hoeven te denken. Maar wat voor mij eigenlijk wel dingen waren waar je juist over na moest gaan denken. En dan kon ik me eigenlijk daar wel over uitlullen, om het zo maar even te zeggen. Zo van, nou, dat doet me niks. Maar van binnen voelde je eigen daar echt kloten door.
Operatie is een risico, maar overgewicht is ook een flink risico.
Een aantal bijeenkomsten van tevoren waar goed in uitgelegd wordt van ja, wat houdt het in, wat gaat het je brengen op termijn. Wat ik dan ook heel mooi vind is dat je lotgenoten, ja eigenlijk wel, lotgenoten ziet. Die allemaal in hetzelfde schuitje zitten. Je bent komt allemaal met dezelfde doelstelling daar naartoe. De operatie is een hulpmiddel, maar daarna moet je het nog wel zelf doen.
En daarna zijn we eigenlijk meteen overgegaan in die modus waar ik van tevoren die goede begeleiding heb gehad. Dat 6 keer eten inderdaad, eten en drinken scheiden. Dat je echt nog wel kan genieten en dat ik echt nog wel lekker kan gaan lunchen en gaan eten. Dat je een keuze moet maken. En die keuzes die zijn echt heel bewust. Die maken we echt heel bewust. En daar heb ik wel denk ik te danken aan dat stukje voortrekt. Al was ik daar niet blij mee.
Ik kan nu wel veel meer genieten van dingen, doordat ik andere dingen kan doen. Noem ik bijvoorbeeld als ik ging wandelen, vond ik altijd best leuk. Alleen was het altijd, ik werd heel snel kort van adem door het wandelen en dan had ik nog niet veel gelopen. En nu lopen we samen de strandtweedaagse. Er is in die zin een hele andere wereld voor mij opengegaan. Ik onderneem nu wel andere dingen als dat ik voorheen deed toen ik leefde met obesitas. Dat was zeker voor mij wel een andere wereld.
Volg je hart, volg je gevoel. Als jij denkt dat de enige manier nog is die jou daarmee een beetje op de rit kan helpen en zeggen van nou, ik moet nu veranderen, ja? Dan ga naar de huisarts en luister niet te veel naar anderen.
Het beheerste wel in een bepaald gedeelte natuurlijk mijn leven. En als je dan met niemand daarover zou kunnen praten, is dat natuurlijk wel heel erg. Want dan raak je in een isolement. Dus mama had dit nog moeten zien. Hè?
Ja.
Zo,
dat zeggen we wel eens inderdaad. Hè? Mama die had dit, in het begin zou zij dat niet heel erg fijn gevonden hebben. Die had zoiets gehad van,
veel te spannend.
Jullie zijn goed zoals je bent en dat klopt, dat waren we ook zeker. Maar die vond het echt spannend. Dus,
maar ze zou super trots op ons zijn.
Ja.
En wij op elkaar.
Ja, zeker.
Ja.
And a huge thank you to Sandra and Colin. I love the emceeing, the roller coaster, because I think if you're a person who has overweight or obesity, you may have been in situations where unfortunately you may not have fit in the seat, just like myself. I've been there many a time and stood there feeling ashamed and embarrassed. And it's just tremendous to see them on the roller coaster, living their lives to the fullest. And as they rightly said, and Ralph and Marcos Antonio and others have reiterated, put yourself in the hands of the professionals. Go to your GP, seek help, seek intervention and care. Now, speaking of the Netherlands, we have a beautiful lady, Natasha, who will join us now. Natasha, how are things going over in the Netherlands on this World Obesity Day?
Yes, everybody's very busy sharing the message, all through the Netherlands. We are trying to get the message out that we want to get recognition for the obesity as a chronic relapsing disease, as well as stopping the biases, the bullying and discrimination of people living with obesity. We do this by our social media channels. We show the video of Sandra and Colinda, of course, our really nice ladies from the Netherlands. We've made a quiz where people can find out in which way they contribute to the stigmas. It's on our website of our Dutch Patient Association. We contributed to a light show, which will be presented on the Erasmus Medical Center in Amsterdam. There had been a radio interview last Tuesday for a local radio station. There have been press releases on the media channels of Medtronics and Novo Nordisk. There were some articles in papers. Well, a lot of is going on, and we are very proud we can be part of this European Obesity Day.
Natasha, I listened last night and you did a tremendous interview when you actually arrived home from our summit here in Lanzarote, and the interview was just so inspiring and it was so relatable as you spoke about barriers and stigma, and it makes me realise as we go from country to country we have so many similar challenges. So to you and your wonderful team over in the Netherlands, thank you so much for everything you were doing, and just a reminder to the audience, please use the hashtag World Obesity Day, hashtag Obesity Day Europe, and let's get these beautiful messages out there. Now, we're going to move on to something slightly different. Our chairman, Ken Clare, can't be with us today. However, he has been working with the wonderful Louisa Ells over in Leeds Beckett University, and they have a little video that is quite beautiful, quite inspiring, and quite informative. So let's move on and see what this video shows us.
Obesity is a highly complex disease driven by many varying factors. Therefore, providing effective solutions and support for people living with obesity requires the skills and expertise from many disciplines and sectors. The Obesity Institute brings together these different multidisciplinary skills, drawing on the academic and professional expertise from across Leeds Beckett University, and also our wider academic, policy and practice partners to address these modern challenges of obesity. The Institute has one clear vision: to improve the lives of people living with or at risk of obesity. All our work is underpinned by our public and patient involvement and engagement hub. This hub will ensure we have a person-centred approach to our work so we can listen to the voices and see the impact of real lived experiences in collaboration across diverse communities. The Obesity Institute will continually evolve, creating accessible and inclusive programmes of work in areas such as prevention, systems science, health inequalities and treatment. The Institute will have 3 key areas of innovative activity: research, education and training, and knowledge exchange. Our core values are showing care, compassion, collaboration, effectiveness, equality and inclusion in everything we do. We want our work to be useful to both the wider public and the individual people that we serve, and to develop a new generation of compassionate, person-centred professionals. To find out more about the Obesity Institute and how it is changing the conversation and landscape around obesity, visit leedsbeckett.ac.uk/Obesity Institute or follow us on our social media channels.
Well, I have to say, as a patient advocate, that is actually really exciting, because Ken has actually, I suppose, spoken many times about PPI and PPE, and I've often wondered, do many people know about this? Do they understand? And when I hear Louisa say words like inclusion and co-creation, collaboration, it gets me excited. Louisa, you are with us from the UK at the moment. I'm going to hand the floor to you and you can share what has been happening, what's been taking place, and congratulations on a wonderful launch.
Thank you so much, Vicki. Well, it's been a real hive of World Obesity Day activity here in the UK. And I guess seeing as you've just seen our exciting animation, I guess I should really start with where we've got to at home, and I'm really excited that this morning we launched our new Obesity Institute at Leeds Beckett University, and it really is a true honour and privilege to co-direct this innovative new institute, which will bring together the multidisciplinary skills, expertise and sectors required to develop more effective person-centred support for people living with or at risk of obesity. And I guess to me what I'm absolutely thrilled about is that our public and patient engagement and involvement hub, led by Ken Clare, who unfortunately can't be with us today, will underpin all of the Institute's activity. This hub, to me, is really critical to the Institute, as we feel passionately that only through listening to and acting upon the voice of diverse lived experiences that we will be able to truly develop effective, compassionate, person-centred approaches that eliminate health disparities and provide everybody with the care and support they need without prejudice, stigma or bias. And I'm really delighted that tackling stigma is also a key theme of other UK World Obesity Day activities. And this includes a fantastic campaign by Leeds City Council, and they've got a hashtag Leeds Against Stigma. And this really aims to raise awareness around the complexity of obesity, encourage self-advocacy, share stories, and really consider policy and practice and organisational changes that are required to address stigma in healthcare. The Council are calling upon us for more action to better support people living with obesity and address weight-related stigma, bias and discrimination. Everybody has a role to play in this, and at a local level they are really promoting the need to ensure our health systems, our schools and employers are better equipped to support people living with obesity, asking for more respect, better care, bold policies and real action, so together we can give everybody the chance to live healthier, happier and longer lives. There's also the wonderful Stand Up to Weight Stigma campaign that's being run by the Super Obesity Empowerment Network in the UK, which is challenging weight bias and stigma, particularly within our children and young people. And at 1 o'clock this afternoon, they launched their really quite moving webinar on this. And I would certainly encourage you to log on and view again on demand. We also have our fantastic colleagues at Obesity UK, who today will be launching their media showcase, and this will be providing some fantastic examples of lived experience stories and accessible science around obesity, all hosted on their lovely user-friendly platform. And then I guess finally, we've got the activity from our UK Association for the Study of Obesity, which today have launched their flagship events, which will be the UK Congress on Obesity. This year's Congress will be hosted at Lancaster University and will have a really strong focus on place. So really thinking about and highlighting the range of places where opportunities exist for intervention. I guess following the exciting bit about this conference is following all of the disruption of COVID, this will be the first in-person UK Congress on Obesity since we met in Leeds back in 2019. So it really will be a fantastic opportunity to meet everyone again in person. And indeed, I hope to see many of you there. So thanks, Vicki.
Thank you so much for that tremendous report. It is so exciting to hear. There are so many things happening today, and Facebook, Twitter, Instagram, LinkedIn, it's alive with news and awareness campaigns. And I love when you use words like bold policy. You know, so let's all do this together, support each other, and please, anybody who's watching, go and support the Obesity Institute. This is a tremendous initiative and something that we're all so excited about. So thank you, Louisa. Now we're going to move on. We're going to stick with the UK actually, because we have a beautiful lady, Nikki, who I actually met in person as well last week at our summit. And this lady has had a story similar to my own in her journey with obesity. Nikki has shared what her quality of life is like after receiving treatment. Let's have a listen to what she had to say.
I've always been the big person in photos at school. I'm the bigger one. Food has always been a comfort to me. However, the weight really started to pile on when I had my first daughter. When I was at home with her, and she's a little baby at the time, I wasn't out working 5 days a week. I wasn't doing any of the exercise that I used to do. I was at home with this new baby, and that was when the weight really started to pile on. You can't walk as quick as other people. You make excuses why you need to stop and have a breather. For me, it got to the point where I couldn't enjoy life with the girls like I wanted to. I went to my doctor's surgery on numerous occasions and said I need some help. And they just say, go on a diet, do this, do that, do this for a year, follow that for a year, follow that for another year. There's not the right amount of support out there for ladies and gentlemen who need serious weight loss help. Until I saw myself on a film that I thought, oh my goodness, there's other people in that picture who to me are a healthy, normal size, and I was twice, maybe 3 times their size. And that, seeing myself on telly and comparing myself to other people, I thought, this needs to change. I need to change my life, and I need to lose some weight. Having weight loss surgery is really scary. The whole process, from picking up the phone to making that first appointment to see the consultant, to actually following it through and having that operation, it's a massive, massive step to take. But it's changed my life, it saved my life ultimately. And I think if you're of a certain size, you know you need more help than just doing routine diets. Now I've lost a lot of weight, I can see the compensations that I did as a larger lady. I can move more now at work, I can get more involved with the children. The clothes, I don't have to either look online for specific large lady shops. I've got more energy as well. I'm able to do stuff with the girls rather than being the token bag holder when we go to the theme parks. I'm on the rides now with them. I'm correct size to be able to fit into the seats. I don't have to stand there and just cheer them on from the sides. I'm there on the rides, they're there holding my hands while I scream as we go around the rides together. As a larger person, I was not disrespected, but sort of in the background a bit more. But now I think I'm treated slightly differently, slightly better than I was a few years ago. Before surgery, I had several health conditions. I still have them now, but they're nowhere near as bad as they were before the surgery. I had high blood pressure and I was taking 2 tablets daily for that. I had asthma and eczema. My eczema has now improved. I only put creams on when I need to, which isn't very often at all. My asthma is really well controlled. I don't need the inhalers anymore. And my blood pressure, I don't take any tablets now. I don't think I would have been able to carry on for many years at the size I used to be. So it has given me a whole new lease of life.
Welcome back, and a huge thanks to Nikki there from the UK for her inspiring video, her words, and for sharing her family with us as well, to empower other people to go and seek treatment and get the correct care. Now, I want to jump across to Slovakia, and I believe that we have Lucy out there who is going to give us some information on the exciting work that's taking place today. The floor is yours, lady.
Thank you very much. Just today is World Obesity Day, and it's very important for us and also important for Slovakia. We know that obesity is widespread in our population after Corona, and we have several ways to help patients with their overweight and obesity. First, at all, I'd like to introduce our newest national project, which called Nordic Walking Against Obesity, which is organized in cooperation with Slovak Nordic Walking Association. We organize events which take place in several cities throughout Slovakia, and every participant can join us in a 2-hour Nordic walking exercise. This exercise brings for everybody health benefits as well as effective weight loss. Another, we prepare a regional project which is located in Bratislava region. This project is challenge proposed by my colleague Hanka, where anyone who travels at least 15 kilometers using the various sports activities like walking or skiing or swimming, we get a free in-body measurement in our center. And today, during all day, we also provide a free measurement for every visitor. We also prepare online online exercise where anyone can comfortable join from home, and other activities. We included the organization of health and obesity prevention days, education of patients about healthy and proper nutritional eating, and the end, we create also education podcast. In the end, I would like to tell you in Slovakia, we have 3 big weapons against obesity. It's information, prevention, and also education of people which have a problem with obesity and overweight.
Thank you so much, Lucia, and a huge thank you as well to our colleague Hannah Vrabkova, who has been a stronghold of support. So congratulations on all your work. I wish you well for today, and we will move across now. Thank you, Lucia. So next up, we're going to actually go to one of the oldest patient organizations on obesity within Europe. I believe that Portugal is probably up there, but I think Sweden takes it by being established in 1996. And we're going to move across now to Charlotte, who's going to tell us what has been taking place with HOBS today. Charlotte, the floor is yours, my friend.
Thank you, Vicki. I'm going to tell you a little bit about what HOBS have been up to. We have sponsored some posts on social media for World Obesity Day. The first one is a video we have made about weight stigma. Patients and experts are interviewed in this video and they talk about weight stigma. And we have also made a short trailer for this video that we have posted on social media, and we encourage people to watch the full video. The second sponsored post is about a support chat. HOBS do several things to support people who live with overweight or obesity. We have support groups, and we also have this support chat. We have it for young people, for grown-ups, and also for friends and family. People want to chat about topics like mental health and bullying, and our volunteers are there to listen to them and help them. We also plan to open a support phone line. The third post we have sponsored is about our report on how people with overweight and obesity are treated by healthcare professionals. We know that there is a lot of unprofessional behavior and discrimination, and we have made a survey to find out what people are experiencing. And the results are horrifying. Patients don't get the help they need. They are told if you lose weight, you will feel better, no matter the reason why they want help from the doctor. And the healthcare professionals also make comments on weight that make the patients feel ashamed or insulted. And it has come to the point where several patients no longer go to the doctor because they are expected to be treated badly. And this is, of course, horrifying. So we have released this report today, and we had an online release event. Healthcare professionals, politicians, and also the general public was there. And now the report is also on our website. It's in Swedish for now, but we might translate it to other languages as well. So this is what we have been up to recently at HOBS. I'm happy to be here to tell you about this. Thank you.
Thank you, Charlotte. Huge congratulations. This report is instrumental for us to understand more of the challenges. And congratulations to your team for all of your work on World Obesity Day. And on that note, we've actually come to the end of our 1 hour session. I don't know how it went so quickly, but I would encourage you to continue to share, continue using the hashtag World Obesity Day and Obesity Day Europe. If you would like to go online, you'll be able to see our beautiful image bank. And we see Jackie here, Fede, Alex, and so many more beautiful people who have given their time to create less stigmatizing images. Now, on this note, I will say goodbye. I will say get out there, act today, because everybody deserves non-stigmatizing language, they deserve support, and most importantly, they deserve treatment. On that note, adios amigos, and I will catch you on the next episode.